In terms of caseload management, I think historically care coordinators would always think that they had the busiest caseload. And what the caseload manager does, it's open for everybody to see, so it's transparent, so everybody can see that they've all got the same workload. What it also allows the team to see is where their colleagues might be struggling. So if they have maybe 4 patients who've gone into a crisis situation, then obviously that increases their workload. And what the rest of the team will do is that they will support that member of staff in that. So where they've got gaps, they will be able to take some of that work from the care coordinator. So again, sort of feeds into that whole team approach.
I guess the benefits of kind of caseload management is that you can really see the work that a care coordinator would be doing. So we can consider their different roles. So for example, if they've got additional roles, like they engage in, maybe they also provide therapy, or they provide family work, or they have another role other than care coordination, so for example, occupational therapy, then their work can be allocated more fairly across the team.
The advantage of the caseload management has been a real improvement in flow and patient flow through the system. So actually there's a really focused part of each month, which isn't clinical supervision, but is actually looking, right, okay, how many initials have you done this month? How many discharges? Can then prioritise what needs to be doing. And even from a personal point for myself, actually knowing, right, I need to now go away and complete the care documents for that person. I need to get that person off the caseload and transferred is a really helpful and containing experience, and also allows, just talking from the team, for the team manager, I think a real, it lowers anxieties, because actually there's awareness of who's coming through the system.
What the team really needs is the support that they need when they need it. So being available for the team on a daily basis will generally make the work more manageable and more plannable than in the old days, when perhaps it was responding at times of crisis, when things would inevitably take longer to try and get things back on track and put in the interventions that would make a difference.
There is something very reassuring about knowing I'm doing what's expected. I think a lot of clinicians have very high standards of themselves and always question whether they're doing enough. Should I be doing more? Am I pulling my weight? And so there's something quite, very affirming about knowing that this is what's expected of you, and that you can go home with a clear conscience knowing that you have pulled your weight and you've done that bit, and that there is protected time between clinical work and other activities, be it CPD, be it teaching, be it groups, be it leadership. Otherwise there is always a pull towards filling your diary with more and more clinical work, and not leaving yourself enough time for the other activities. So I think, again, activity planning helps with some of that structuring.
So what was agreed was everybody would have access to everybody's diary, so it was all transparent, everybody knew exactly what was going on. We set up a system with the admin staff so that they had the control to put the reviews and things and the initial assessments into the CPN's diaries right at the beginning, and they just needed to sort of ensure that they attended those meetings for the right reason.
I think the fear is that people feel are going to lose that control. Actually, we haven't lost control. Yes, things are put in our diaries, but the way that we set them up meant that we organised the days we wanted to organise the day. So our initial assessments were slots throughout the week. Our interventions, our follow-ups were all slots throughout the week, but we decided when they were. So even though we've kind of lost that security of being able to write ourselves, actually we've still got that control.
So I think once it started, people started to see the benefits and started to think, okay, actually, you know, I was on my day off that day, but that family's been able to rearrange an appointment without me via the admin staff. Actually, that's really helpful. It saved me some time.
It's much easier to get a sense of making sure that the workload is manageable for all. Sometimes I think we get caught up in what we need to do for our job, but actually there's a role for what the team needs us to be able to do, and to plan our work accordingly so that we're all utilising the resources in the most effective, efficient manner.
Everyone has an overview as to who's doing what and where everyone is, which just helps. It just helps, especially when you're doing duty and think, right, who else is in today? Oh, they're in. They can kind of help me with that bit.
We can look in diaries and we can anticipate what our demand is going to be and where the work is going to be. And if need be, we can move the resources to meet that demand.
The staff are working better together and are supporting each other more. So if somebody is off sick, the staff, before I even get to think about it, the staff have actually come up with an alternative solution.
It does just give you a much better sense of where the pressures are across the team and how individuals might need some additional support, or indeed be able to support other individuals within the team in a more coherent, planned way than the old days of just firefighting and having to find extra time for things.
It's increased transparency, so it's really helped with planning, with just being able to see what's there rather than it being bits of paper and everything. In terms of for service users, I think the fact that they can then go and book an appointment because admin can access the diary straight away has been a really positive move, rather than it being something like I'm going to go and check and come back. It just feels as if we're kind of moved into this century in terms of actually working with IT systems to provide a comprehensive flowing system. And from a clinician point of view, I found it really valuable. I think I'd be completely lost if I didn't have that.
So what the guide allows us to do is at a glance see what's been offered, what's been declined, and most importantly, if we haven't offered it, why not, and what our next step would be.
Staff, despite being a bit resistive, have started to use it and are seeing that it's beneficial to the patients and the carers, because it's another way of actually ensuring that all the staff are aware of what point of the pathway the patient's on, so that if there's any issues, if the key worker's not available, then any member of staff will know at what point in the pathway they are and what needs to be offered to that patient, or what needs to happen if there's any issues that come up and that's discussed when that person's key worker's not available.
When we were first introduced to the recovery guide, where we had to stick stickers on saying what we were going to do next, what wasn't applicable, I think we all thought, oh, this is going to be very time consuming and a waste of time. But now we've kind of developed the way it works. We're aware for each other what's the next step. If somebody was off on leave or off on sick, we all know what everybody else is going to do. We also take it to reviews, medication reviews and reviews with the patient, so we can say, look, this is what we've done, this is what we haven't done and why we haven't done it, this is the things that you weren't interested in, and we use it like that as well.
Using the recovery guide with the patient is a really helpful thing to do, because at a glance they can see the journey that they've had within the team. They can also see what might be coming next, and the care coordinator can, I can, so we can see the full range of what's been thought about and think about the timing and prioritisation of certain interventions, and wonder if things haven't been successful the first time round, is there scope for thinking about it at another point in time, or in fact do we need to switch tack and try a different approach?
It really helps them feel empowered to make some choices within healthcare, which is something that we didn't really have before we had the recovery guide.